Nearly 3 months after Ghana recorded its first COVID case, the Bono East region became the 15th region to have recorded a case after a driver in the Pro East district tested positive. This was the then regional minister, Mr. Kofi Amwakwahene.
Total samples taken, 1,239. Results available, 362. Negative results, that's tested, 361. Positive results, 1. Results pending, 877.
With pressure mounting on the two major testing centers then, the KCCR and Noguchi, authorities in Kintampo called for the consideration of the Kintampo Health Research Center as a testing center. Here is the MCE for Kintampo North, Mr. Michael Sarkodie, for making the appeal.
The research center has capacity to test, and so I'm using this to appeal to the health authorities to look at Kintampo Health Center. It has the capacity. I'm reliably informed that it has capacity to also test.
The center then lacked a PCR machine which was key to the testing of COVID. Fortunately, a former MCE for Kintampo North donated an amount of $30,000 for the purchase of the machine.
Thanks to the donors, that is Mr. Abdullah Razak and family. This kind of gesture has opened an entire milestone for Bono, Ahafo, Bono East, and indeed the entire country.
A year on after Ghana recorded its first case, we paid a visit to the only testing center serving the Bono East, Bono and Ahafo regions, the Kintampo Health Research Center. Dr. Kwaku Poku Asante is the director of the center.
Immediately, the Ghana Health Service announced the challenges with it, and we realized that we could put a medical laboratory, which we call the Seth Owusu Medical Laboratory, to test for COVID-19. The laboratory has a virology lab, but at the time it wasn't set up to do large volumes of testing. And we've been able to stand the test of time to put our laboratory into good use in fighting against COVID-19 in the area of COVID testing.
Though this development served as a challenge, Dr. Poku Asante says he's happy the center lived up to expectation.
It's been a challenge that we braced ourselves to overcome. Why? Because our focus has been research, and so we had to refurbish some of our labs to meet the new demands. We had to put staff from different schedules onto COVID-19 testing to meet the demands. And I'm excited that the staff have actually braced themselves to overcome that, and is working well.
With heavy demands between the months of January and February this year, the center had to expand its workforce to be able to meet demand.
We realized the number of cases had gone up again in late December, January into February. So that put a lot of demands on the testing. And so, though the numbers increased, the dedicated staff expanded, and we maintained the duration within which we were to deliver reports, which is 48 hours.
Inside the virology unit, Farid Boadu is currently in charge of the PCR machine. He shares with us what goes into the final stages of the test.
Per the procedure we are using here, it takes about 2 hours for a complete run to be done. And when that is done, that is not it. You need to analyze what you have done, and then based upon your analysis, you can say this sample with this ID is positive for COVID or not. So it's not easy for when we have our peak times where samples come in and you need to run. So we are running on the clock just to get results for patient management.
The center aims at expanding its laboratories to be able to do more tests and called for the support of the general public.
Various stakeholders, philanthropists within the area or anywhere else to support us in our next step. Our next step is to expand the little laboratory that you saw for COVID testing into a larger laboratory that will be able to do monitoring and surveillance and test much more samples at a shorter rate than before.
From the Kintampo Health Research Center in the Bono East region, I am Anas Sabit for Joy News.